Your doctor wrote 2 words on a notepad. High blood pressure. Then handed you a prescription, shook your hand, and the appointment was over. No explanation of what the medication actually does inside your body. No conversation about what caused the problem in the first place. Just take this once a day, see you in 3 months. And here's what most men never find out until it is far too late. Amlodipine does not fix anything. It manages something. And the men who understand that difference, truly understand it, get dramatically better outcomes than the men who don't. I have spent most of my career working with men over 45, and the ones whose blood pressure is genuinely under control, the ones whose arteries are actually healthier at 60 than they were at 55, they all share one thing in common. They understand what is happening inside their body. Not just which pill to take, but why it works. And critically, what makes it work better or worse. So let's get into it. And before we do, if you're new here, I am Dr. Joseph, and on this channel we go deeper than a 7-minute appointment ever could. Hit that subscribe button right now, because what I am about to share is exactly the kind of information your doctor simply does not have time to tell you. Most men think of high blood pressure as a heart problem. You see the number, you associate it with stress on the heart. And that is fair, the heart is under strain when pressure is elevated. But the real story does not start there. It starts in the walls of your blood vessels. Your arteries are not rigid pipes. They are living tissue surrounded by smooth muscle that contracts and relaxes with every single heartbeat. When you are younger and those muscles are healthy, they flex naturally. They absorb pressure and release it. But here is what happens over time. In millions of men in their 40s and 50s, the muscles surrounding those vessels begin to tighten chronically. They stop fully relaxing between heartbeats. They hold a state of low-level contraction, like a fist that never completely opens. Not aware. 2. Same amount of blood trying to get through. Pressure goes up. Now here's the precise biological mechanism behind that tightening. For those smooth muscles to squeeze around the artery and raise your pressure, calcium ions have to enter the muscle cells. This is not a metaphor. This is literal molecular chemistry happening thousands of times per second inside your vascular tissue. Calcium flows in through specialized proteins embedded in the cell wall called L-type, voltage-gated calcium channels. Tightly regulated doors set into the wall of each muscle cell. When those doors open, calcium rushes in, binds 2 proteins inside, and the contraction signal fires. The muscle squeezes. Amlodipine does one thing, and it does it extremely well. It physically binds to those channels and blocks them. Calcium cannot get through in the same quantity. The smooth muscle around your artery cannot receive its full contraction signal. The muscle relaxes. The vessel widens, blood flows more freely, and your blood pressure drops. What makes amlodipine particularly effective is how selectively it targets the vessels. It does not slow your heartbeat the way some other medications do. It does not affect your kidneys directly. It works specifically on the mechanism of contraction in the smooth muscle of your arterial walls. That specificity is one reason it has a relatively clean side effect profile for most men. But here is what nobody told you. The calcium channel is blocked. The vessel is held open, but the reason that smooth muscle wants to squeeze in the first place, the chronic tension, the stiffness that built up over years of high sodium, low activity, accumulated stress, gradual arterial stiffening, that is still there. The medication is keeping the gauge in the safe zone. The underlying engine is still running exactly as it was before. And that gap between managing a number and actually addressing what created it is the gap that eventually catches most men off guard. Let me give you a real example. A patient I will call David. 58 years old. Blood pressure 162 over 94, slightly overweight. High-stress job. Diet built around convenience food. A pattern I see every single week. He started Amlodipine. Numbers came down within 2 weeks, and David told his wife he was fixed. Stopped reading labels, went back to his old routine, kept taking his pill every morning. 18 months later, he was sitting back in my office with numbers creeping up again, and his doctor talking about increasing his dose. David was frustrated. He had done everything right, he said. Never missed the pill. Here is what happened. The calcium channels were blocked, yes, but the biological environment around those channels, the sodium overload driving fluid retention, the arterial inflammation from a poor diet, the sustained vascular tension, None of that changed. The pressure driving the vessel walls to squeeze kept building underneath, and the medication had to compensate for more and more. David did not fail. He simply was never given the full picture. Now let me address the side effects properly because they deserve a real explanation. Ankle swelling is the most common, appearing in around 5 to 10% of people on amlodipine. Men assume their kidneys are struggling or their heart is under strain, but here is the actual mechanism. When amlodipine relaxes the arterial walls, it creates a pressure gradient that allows more blood to enter the tiny capillaries at the ends of your legs. Some of that fluid seeps into the surrounding soft tissue. That is the swelling. Your kidneys are not involved. Your heart is not in danger. Elevating your legs for 30 to 40 minutes in the evening helps significantly, and for most men this effect diminishes on its own within the first few weeks. Flushing warmth in the face, redness of feeling that your skin is running hot, can happen in the early weeks. Your arteries are wider than they have been in a long time. Blood is reaching capillaries in your face and neck. Morzelli, your body is simply recalibrating. For the vast majority of men, this fades without any change in dosage. And one critical warning, grapefruit juice. There is an enzyme in your gut wall called CYP3A4 that breaks down amlodipine at the correct rate. Grapefruit contains compounds that suppress this enzyme, meaning more amlodipine enters your bloodstream than your prescribed dose is designed to deliver. If grapefruit juice is part of your morning routine, switch to something else and mention it to your doctor. Now here is the part that actually changes outcomes. Research has repeatedly shown that the right dietary approach can lower systolic blood pressure by 8 to 14 points when followed consistently. A starting dose of amlodipine typically lowers it by 10 to 15 points. Read that again. The right lifestyle intervention comes within range of a starting dose of medication, and when you combine them, they stack amlodipine blocks. The calcium channel, the right diet changes the chemical environment around that channel, reduces the forces driving the muscle to contract, and improves the elasticity of the arterial wall itself. Two different mechanisms, same direction, working simultaneously. The most rigorously studied dietary approach for blood pressure is the DASH protocol. It is built around 3 foundational levers. Sodium reduction. Most men I see are consuming between 3,000 and 5,000 milligrams daily. Without realizing it, mostly from processed foods, commercial bread, deli meats, and restaurant meals. Not from the salt shaker. Potassium optimization, avocados, sweet potatoes, white beans, and plain yogurt actively signal your kidneys to excrete excess sodium and magnesium directly involved in smooth muscle relaxation through a completely different pathway than amlodipine, with research showing 200 to 400 milligrams of supplemental magnesium daily can meaningfully reduce blood pressure in men who are deficient, which is a surprisingly large proportion of men in their 40s and 50s. For months after that discouraging visit, David came back. He had started cooking at home 5 nights a week, swapped processed lunches for whole foods, added magnesium glycinate before bed, and dropped the daily grapefruit juice. His blood pressure was lower than it had ever been since starting medication 2 years earlier. His doctor reduced his amlodipine dose at that appointment under careful supervision. David was not a special case. He finally had the complete picture. One final thing, and I want to say this clearly. Never stop or reduce amlodipine without your doctor's explicit guidance. Even if your numbers look perfect, especially then, the reason you feel fine is precisely because the medication is doing its job. Stopping it suddenly can cause a dangerous rebound rise in pressure. What you can do starting today is create the conditions under which that medication works most effectively at the lowest necessary dose for as long as possible. The pill is the floor. Your choices determine the ceiling. If this gave you something useful today, please hit the like button. It helps more men in this exact situation find this information when they genuinely need it. Drop a comment below and let me know when your doctor prescribed amlodipine. Did they spend any time talking to you about diet or sodium reduction? Just write yes or no. I read every single response. And if you know someone who recently started blood pressure medication and still has questions, send this to them right now. Subscribe if you have not already, because this is exactly the kind of conversation we have here every week. I will see you in the next one.